And welcome into To Your Health. A true story. A good friend of mine just recently had his father that became very, very ill, and he was told that they needed to put him into a hospice nursing facility. Well, he went and looked at the facility, and you know what? He just didn't feel right about this, and he felt, you know, these are the final days of my father's life. I want him to be the best. In many cases, you have to be very careful when you're going to be looking into some kind of care for elderly people. And my guest is Steve Brigance. And Steve, you have a company that's called the number 4, Our Elders. And of course, you've got a great background in the nursing home field. An attorney, you worked for one of the biggest companies, Beverly, but you decided that you're going to start this company. And what should our viewers look for when they're going to be choosing a facility?
First of all, I think you start with assessing the person that's about to move in, that needs the care. You get a realistic understanding of what the acuity, the level of acuity of your loved one or you actually is. Do you need an assisted living facility? Do you need a skilled nursing facility? Can you exist in an independent living environment? You try to match the environment that you're looking for to the person that is looking to locate there.
Let me just
Sure.
Independent living truly mean that really you're there to take care of yourself. But are there medical people that can be associated with an independent living facility? Or?
Jack, our company is national, and so we're in all the states, but it means different things in different states. It's just like an assisted living facility. In the state of Arkansas, my home, there are 2 levels of assisted living facilities even. In your state, there is not. And so different local state regulations will govern. In independent living, most good facilities will have care available. They will be able to do separate contracts. If you need a higher level of care than just independent living, for example, someone to look in on you periodically because you don't have a loved one near, if you need medication advice in terms of dispensing medications to you, they can do that. We have a great facility called Greenhurst in Charleston, Arkansas, not far from Fort Smith. It has all levels that it can offer its independent living folks. And so that's really what we encourage people to look for. Because I will tell you, many times going back to that initial thing of assessing the condition of the person to move in, you tend to want it to be better, and you want to give the lower level of care. And I know many clients we've had where the loved ones have been put into an independent living, but they're in stage 1 or stage 2 of Alzheimer's, for example. And pretty soon after placing them there, they figure out they're just not suited for that environment, and they have to move them. Every subsequent move of a senior is hard.
Oh, it's traumatic
hard on
them.
The family,
Absolutely.
It's hard on the individual.
Right. Because obviously, as you mentioned in our other interview that we did, that the facility is a place for them to stay, but that also becomes the family.
Their home.
And you're now, not only are they separated from their biological family, but now they can be separated a second time from this other family. And
the sad thing is, in our country, there are a lot of sad things, but not necessarily scary things if you do it right about becoming a senior. But one of them is that about half of our seniors, 65 and above in this country, have no family member, have no loved one to take care of them. And that can be scary. And so what you're looking for when you're looking for a facility, first of all, I want to look for a facility that's not just a facility. We look well beyond the bricks and the mortar, as we say, whether they have a whirlpool. Those are all amenities.
Yes.
We look for care, service, and safety, and we look for a community environment. We look where the caregivers absolutely love their patients, their residents, and they take care of them, because even if you're lucky enough to have a family at 65 or 70 or 75, many times they're remote. They can't be in there every day.
That's right.
So you need someone being like family to them 24 hours a day, 7 days a week.
Now, how does a person, obviously, they can go online and learn about your company, and your company was designed basically to do a lot of the groundwork and to, obviously answer questions that they may have. And you can answer just about every question that a client would have, can't you?
We can. We evaluate facilities. We don't reject them. We work with the families to try to find the best possible environment for themselves or the loved ones. And we look at the things that they want, amenities. Is it close to a relative? Is it close to shopping, to doctors? Does it have a whirlpool? What are the room configurations? All of those things are amenities, and we look for and we try to find that. But basically, we measure the culture for safety, the culture for care and concern, care and service, both for the loved one that's in the facility as well as the family. We measure people, and there's not anybody else out there that does that. But I will also say, you don't have to hire me. Your listeners don't have to hire me. I encourage, if they are facing a decision about putting a loved one or themselves moving into a long-term care facility at whatever level, go to my website.
Okay.
Take a look at, we give you specifics of things to ask for, things to do in advance of going into whatever home it is. We help prepare you to go in so that you don't have to hire us at all. You can go in and do it yourself. Sometimes it means asking the hard questions, and when you get no's, following up on the hard questions. But you mentioned earlier, but we spend an awful lot of money in this country vetting schools for our children if we have competition for our schools. At the other end, though, so many times we rely on the easy approach for our loved ones. For example, there are many free sites on the internet right now. Placeformom.com places people every day.
We've seen that.
They have 8 figures of gross, 9 figures, I think they're up to in gross revenues.
Wow.
They are basically off-balance sheet marketeers.
And, you know, they also have for Dad now, too.
They have
Thank
them
goodness.
Both. They have them both. But what they do is they are paid by the facilities where they put your loved one or you. They're not paid to put you in the best possible environment. They're paid, and they're paid by people that want you and need you. We used to use them at Beverly, for example. And we used them where we had facilities where we could not fill our own beds because our service was not very good at that time.
So that's the way.
So go to our website.
Good.
Encourage your listeners to go to our website, take a look at it. We've tried to make it user-friendly. We're beyond what is on the websites out there from the government. We look at different things. Our data is new. We look real time at what's happening in a facility today, not what happened 5 years ago.
And you're totally independent, which is wonderful.
Absolutely.
Good. Steve, so much.
Thanks. You, Jack.
It was wonderful. So just remember, as Steve said, do your homework. It's going to save you a lot of time, a lot of worry, but most importantly, it's going to make sure that you're putting that loved one in the best possible place that they can be put. And we'll be right back right after this.